Good afternoon. My name is Cheryl Warfield, and today we're going to assess the respiratory and cardiovascular system. Who do I have the pleasure of assessing today?
Linda Warfield.
Okay, Ms. Warfield. At various points of the assessment will involve me putting my hands and/or my stethoscope on you. Is that going to be okay?
It's okay.
Okay, great. So first, we're going to start with the respiratory system, and I just have a few questions for you. Are you having any issues right now? Cough, shortness of breath, difficulty breathing?
No.
No? Okay, great. Have you ever had any respiratory issues in the past?
No.
No? What about your family history? Any asthma, COPD, bronchitis?
No.
Okay. Are you a smoker?
I'm not.
Are you around any secondhand smoke?
No.
Okay, great. And so from there, we're now just going to assess your respiratory system, and I'm going to start with the inspection. And from here, I don't see any discoloration to the anterior chest wall. If you don't mind, I'm going to have you cross your arm over your chest. I'm assessing her AP diameter, and her chest wall does not appear barreled. And then her posterior chest wall, I'm just going to peek at your skin tone on the back. I don't know any discolorations to her skin. Okay, Ms. Warfield, I'm going to place my hands on you to palpate for any tenderness or pain. Please let me know if you feel any at any time throughout this assessment. Any pain or tenderness when I palpate?
No.
What about now?
No.
And any here?
No.
Okay, and we'll palpate the anterior chest wall. Any tenderness?
No.
None there either.
None.
Okay, and so throughout that palpation, we also look for any nodules or lumps or bruising, and again, she did not have any. And so now, I'm just going to assess your lung expansion, which will involve me putting my hands on you again, and I may pinch your skin just a little. And when I ask you to, I want you to take a deep breath in and out. Okay, in and out. And one more time for me. Okay, and we will measure the anterior expansion. I'm sorry, it's involved me putting my hands on you. In and out. And one more time. And she has symmetric expansion of the anterior and posterior chest wall. Now it's going to involve me auscultating your lung sounds. And we are using the diaphragm of the stethoscope. Okay. All right, Ms. Warfield, I'm going to have you take deep breaths in and out. In. Sorry, but and one more. Her anterior lung sounds are clear. We're going to assess posteriorly. Ms. Warfield, it'll be the same thing. We're going to listen, and as I place my stethoscope, please take a deep breath in and out. sounds are clear. Okay, Ms. Warfield, we're now going to assess for tactile firmness. When I place the side of my hands on your back, I'd like you to say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and we will assess the anterior wall as well based on checking for vibrations and being able to feel them as normal. Please say 99 again.
99, 99, 99, 99, 99, 99, 99.
Okay, great. Ms. Warfield, I'm now going to listen as you say 99, and what I'm doing is checking for consolidation. So when you feel me place my stethoscope, please say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, and if you can for me, please whisper 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, and with both of those assessments, I was unable to hear them loudly, and her 99s were both diminished, muffled sound, which is what we would like to hear. If they were enhanced, or I was clearly able to hear her say 1, 2, 3, then we would go further with the consolidation assessment. Okay, Ms. Warfield, and so now we're going to move on over to the assessment of your cardiovascular system, and I'm looking at her face. I'm not noting any edema anywhere, no edema of her eyelids. Her lips are appropriate for skin tone, so they're not cyanotic. I will put my hands on you, and I'm just checking your lymph nodes. I'm sorry. And we're checking the ones in front of the ear, posterior, behind the ear, the ones in her neck, and at the jawline. Okay, Ms. Warfield, I'm going to go down. I'm going to check the lymph nodes near your clavicle, and then the ones in your axillary area. I'm still not feeling any enlarged lymph nodes, and I'm going to have you place your arms at a 90-degree angle for me. And I'm just assessing the inside of the arm for any lymph nodes in the brachial area, brachial region, and I don't feel any lymph nodes. Okay, Ms. Warfield, so I am now going to auscultate your cardiac sounds that involve me placing my stethoscope on you, and from there, we're just going to assess your pulses. Okay, and we are, in order to listen to heart sounds, we're going to second intercostal space, and we're going to listen to the aortic sound. Second intercostal space as well for pulmonic. Third intercostal space for Erb's point. Fourth intercostal space just to the left of the sternal border for tricuspid. And then fifth intercostal space, midclavicular line, is where we are going to assess the mitral valve, which is also the apex of the heart, and how we get our apical pulse. I'm sorry, I'm just going to go a little bit under your breast. And while I'm here, I'm also going to count her apical pulse. beats per minute. Okay, Miss Warfield, now I'm going to assess your pulses, and I'm going to start with your carotids. Okay, and now for the other side. Well, I'm also here at your neck. Can I get you to turn your head at a 45-degree angle in that direction? And just slightly tilt your head. And what we're looking for is JVD, and I'm not noting any jugular vein distension on the left side of her neck. And I'm going to have you turn to the opposite side. And I don't know any jugular vein distension on the right side either. Now I'm going to put the bell of my stethoscope on your carotid arteries, and I'm just listening to make sure that they're patent and that I don't hear any abnormal sounds. When I place my stethoscope, please hold your breath for 10 seconds. You may breathe out and 10 to this side. And you may breathe out. Okay. And so now we are going to assess your radial pulses. And her radial pulse is the 3+ bilaterally. We're now going to assess your popliteal arteries. They are also 3+. Your posterior tibialis, which is the inner part of your ankle. 3+ bilaterally, and now dorsalis pedis on the top of your foot. And they are also 3+. I'm gonna check your capillary refill and your toes. Capillary refill is less than 3.